What's up, everybody? I want to thank you so much for our unconventional weekly webinar this week with Dr. Jay Greenstein and Brad Cost. I am excited about every webinar every single week, even when we don't have technical issues where a server happens, everything crashes, we move to a whole nother platform. We don't tell you guys about it, but that's not to worry because you're all getting this information today. And I want to take the time to thank you for taking additional time out of your busy schedules for watching this incredible information. And I'm not just saying that because, I happen to be the #1 fan and president of the TikTok podcast. These are our two hosts of that awesome podcast. If you're not listening to that, I'm going to just tell you, you should be. There might even be an upcoming episode where Christy is on it. Lord help me, because I said some stuff and I was incredibly nervous. I tried to think of it as an extension of a conversation that Brad, Jay, and I would have at a bar, and didn't really quite work out like that. So it will be entertaining and fun, as every one of theirs is. But entertainment and fun aside, if you do not know who these incredible gentlemen are you living under a rock? Because they are, I would frequent, at least annually, presenters on our webinar. But more than that, they're so heavily involved within the chiropractic profession. And I could spend the next 45 minutes to tell you everything that they're doing, but I won't. So in brief, I'd like you to meet Mr. Brad Cost, who is the president and owner of Infinity, which is a clearinghouse that you should be using in your practice, and we'll talk about why. But more than that, let me tell you about all the work that he spends taking data, gathering that information, and utilizing it to help strengthen the chiropractic community, to help us fight the battles that mean the most to you and your practice. He and Dr. Jay Greenstein, who is the CEO of the former sport and spine companies now known as Kaizo Health, which are multi-location, multidisciplinary, evidence-based practices in the Washington, D.C. metro area. But wait, there's more. You might have heard of a little app called Kaizenovation. Is it Kaizenovation or Kaizenovate? Like, it's Kaizenovate, it's on your shirt. Okay,
this app, Canvas app, and the company is Kaizenovate.
Okay. All I know is it's a really cool app, and I am totally against ever downloading apps on my phone because they take up too much space. However, I have friends who utilize this app in their practices, and I have it because, as you all know, I was in a car accident in October and I needed stretches and stuff to help me be able to navigate those airports to travel all around the country to see your beautiful faces in person. And one of my dear friends, Dr. Alan Sokoloff, who was treating me while I was traveling, had me download his app where he was able to assign web exercises to me to keep me on track and track my progress as I was traveling, and doing that independently away from him until we were together again. Not only was it fun, I also openly admit that I don't do home exercises. I lie. So my chiropractor, I am that patient, but I didn't, and he could tell that I didn't because I was logging into my app. So if you don't know anything about that, just know that you should definitely go by and see Jay at an upcoming event, or reach out to his team to learn more about how the app is going to help you to grow your practice. And boy, is it going to make you popular in your community. But we're not here to talk about that either. We should have a webinar about that real soon, Dr. Jay.
Sure, anytime.
All right. So now I'm going to turn it over to Dr. Jay and Brad, and they're going to talk to you about this incredible work that and technologies that they've been working on for months, maybe even years. I remember talking about it. Now it's come to fruition. Not only are they going to tell you about what they have created, Brad built, but how it's going to help you in your practice and help the chiropractic profession. Gentlemen, take it away.
Thank you, Christy. And I just want to thank you for literally building the largest and best webinar program in the country, in the world, for chiropractic. You've done a tremendous job. Obviously, I'm a huge fan of CHUSA. I've been a customer for a very long time. It is truly the network that works for chiropractic. So thanks for having Brad and I. I definitely want to give Brad a little bit more of an intro as well, because Brad, as I describe him, is the most important non-chiropractor in chiropractic. This man has dedicated his life, an incredible amount of time and money and resources from his company to help this profession be information enabled. And I'll explain in detail what that means in just a little bit. But anytime you see Brad, either virtually or in person, please go up to him and thank him, because he is changing the game for chiropractors, our practices, and the patients we serve. So Brad, thanks so much for joining me today.
You bet, bud. Jay, I appreciate the kind words. Again, as you know, working together with you and the profession and the things that we're doing is going to change this profession and really change how people interact and how the world sees chiropractic. So thanks for being our spokesperson today. Take it away, my friend.
All right, here we go. So today's conversation is all about leveraging data to maximize cash flow. And I want to share kind of the entire story with the entire audience, because there's more to this than just, some slides around cash flow. This is really about taking an understanding of data, how it applies to the profession, and then how it applies to your individual practices to really move the needle for us globally. So talk about okay, what does this look like for chiropractic and the profession? But then I'm going to share at a very intimate level, because I'll share data from my own practice, what's in it for you, right? Like, how does this apply to you as an individual chiropractor? How do you drive faster reimbursement? How do you drive greater cash flow? How do you have a better understanding of inappropriate denials and bundling? All of this is at your fingertips potentially, but you've got to be using the right platform. Here we go. Let's talk first about data and the chiropractic profession. So hopefully you all know, but if you don't know, the chiropractic profession has undertaken a strategic plan. And the core values around this plan are transparency, inclusion, and collaboration. If you don't know anything about it, please go to chirocongress.org. Click on the resources tab in the menu, scroll down for the Future of Chiropractic Strategic Plan, and literally every and any piece of information that you need around this plan is at your disposal. It's at your fingertips. And I'll give you a high-level overview of what we're doing. So when we set out in November of 2019, and when I say we, multiple leaders and state association leaders, vendor leaders, company leaders like Brian, we all set out in November of 2019 at the Chiro Congress convention. We all did a workshop, and it was led by none other than Dr. Ray Foxworth, who is the CEO of Chiro Health USA, and myself. We facilitated a discussion at Chiro Congress. There was a previous discussion the day before at the Chiropractic Summit meeting that we needed to have a strategic plan built for the profession. It was time that we grow up as a profession and have a real strategic plan. And it was decided and lobbied by several of us in both of those meetings, the Summit meeting and the Chiro Congress meeting, that we had to have it done by a professional. We couldn't do it on our own anymore, because I love this quote: if you think it's expensive to hire a professional, wait until you hire an amateur. And many of us in some of these networks, these groups that we do a lot of volunteer and advocacy work in, have had the experience of doing it just among ourselves as chiropractors, and it just hasn't worked. So we set out on a strategy. The Future of Chiropractic Plan, strategic plan task force set out to essentially find the best facilitator who could help us do this work. And not only did we find the best facilitator, we actually found 3. And we knew that each one of these 3 facilitators actually had strong strengths. So Future IQ, they were all about leveraging data. Again, a core fundamental concept that we're going to be talking about today. And what they did is they built surveys for the entire profession. And we know the demographics of the people that answered this survey, over 4,000 people, which is a huge sample size across all elements of the profession: ACA members, ICA members, state association members, vendors, educators, field doctors, you name it. Every element, every corner of the profession was represented. And one of the core questions was, okay, so what is the expected future for us? What does our professional pipeline look like, which was this axis? What does industry acceptance and utilization look like? Are we going to be accepted in healthcare and by the general public, or will we continue to see literally 14% of the population? Will we have a professional pipeline of research and students, and can we decrease costs in the educational institution, or is it going to be the same old, same old? Now, obviously, increasing our professional pipeline, increasing acceptance and utilization is this quadrant right here. That's a, I believe is a good quadrant, but people had, as you see, a wide distribution of kind of the expected future for us. So Are we going to transform our industry? Are we indispensable health allies, or are we continuing to be, well, isolated? And is it going to be the same old Groundhog Day? And you can see again, like there was a lot of people, again, 4,000 people, a lot of people who said like nothing's going to change. This is where we are. This is the profession. We can't get along with each other. We argue too much, blah, 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 blah. And when they asked the question, what is your preferred future? Literally, there was complete alignment and agreement. You had some outliers here, but at the end of the day, the vast majority of this huge sample size said, yes, we all want to transform our pipeline. Yes, we want to be indispensable health allies. So Future IQ helped us walk us through these critical questions, this data, and a wide variety of questions that were asked, and the data that was garnered from their surveys. Because once we had the data, then we could go into actually creating plans. We could create goals for a strategic plan. That's where Charity came in. Charity, their area of expertise is really about alignment of concepts, alignment of thought, alignments of goals and initiatives, and working with people from disparate areas of organizations and or professions to align them. And they did an awesome job. Again, we had these work group meetings after looking at this data, and we all agree. Like we didn't agree, but we had professional debate, and it was and so we were able to work through a wide variety of these questions that were asked, the data that answered some of these questions, and then ultimately come up with our 5-year, 3-year, and 1-year goals. Like we've never had this as a profession before, you guys, and this is critically important. It's a huge step for our profession to actually grow up. So we created these objectives, these very specific and smart goals. Now, related to this was creating a leadership structure. So we have the leadership committee, we have a project manager, and Brad and I are co-chairs of the Chirotech Consortium. And trust me, I'm going to get to the data in just a little bit, but you've got to understand this context. Other work groups that were created, fundraising, who our wonderful host, Christy Cook Hudson, and our amazing friend, Lisa Love Smith, they are the co-chairs of the fundraising work group. But there's public facing communication work group, interprofessional communication work group, research work group, government affairs work group, and then under that is the hybrid super PAC work group that's essentially run by government affairs. So a very organized structure to help execute the strategies and the plans to get us to that upper right quadrant of the strategic plan. The third group was all about leveraging technology. So now that we looked at the data, we polled the profession, we looked at the answers, we looked at the data, we came up with goals related to that data and the answers that the profession wanted. By the way, the profession owns this plan. There is not one group or organization that owns this plan. Yes, the information is housed in the Chiro Congress website, but they don't own it. It's for the profession. You own it, I own it, Brad owns it, Christy owns it, we all own it together. So the third stage was, and the third group that we worked with was all about leveraging technology to drive this innovation. And that's where the company On Strategy came in, where we're leveraging their tech platform to track goals. Now, anybody who's listening to this podcast who creates goals, writes them down, tracks them, they're probably the upper 10% of achievers that are on this call, because anybody who's good at achieving goals knows that they have to be established and written down, and accountability must be tracked. And what was great about using On Strategy, what is great, because we're in this phase right now, phase 3, what's great about using On Strategy is we are held accountable every other week to achieving the tactics, objectives, and strategies as it relates to these goals. All the work group chair people get on these calls every other week, and we've got to report on the progress that we're making. Trust me, when you have high achievers and leaders in a room or in a Zoom, either one, nobody wants to be the person who's like, yeah, I didn't do that this week, or I didn't get that done. So having this transparency holds everybody accountable. And it's amazing the traction that we're creating, the progress that has occurred, in these work groups, moving the plan forward. And I'm going to share with you what Brad has done for us as it relates to the Chirotech Consortium plans in just a minute. What's also really great, if you remember the core values around this, it's also really important to understand there's a lot of collaboration between the work groups. So this is, most of you know Dr. Heidi Havik. She's the chair of the research work group. She asked me to join a call where they essentially interview me and find out more about like my thoughts related to technology and research. And so we're able to have a really productive discussion so that we're not like all recreating the wheel. We're working together towards common goals that we all know are important to achieve. These are members of the Chirotech Consortium work group. In the lower left, you can see Dr. Corey Frogley from Blue IQ. This is the other members of the work group around the table. And we are doing an exercise called question storming. How might we? We wanted to find out and think as big as we could about how might we use technology to drive the profession forward. And we have lots of leaders in the profession that were not necessarily even part of the committee, but they joined us for that session that day just to be able to provide input, again, in the spirit of collaboration. At the end of the day, we came out with that meeting knowing exactly what we wanted to accomplish in the first year, 3 years, and 5 years. So I want to just share really quickly again, what's different about doing the strategic plan and how that's different from many years past of chiropractors saying we want to achieve certain objectives. Well, one, we're living our core values. It's all about transparency. It's all about collaboration. It's all about making sure that we've got the right focus to drive the results that we're looking for. We hire true professionals. We establish, excuse me, a strong structure of the plan forward. We leverage technology, drive execution of the plan. And at the end of the day, there's strong collaboration, commitment, and execution. So if you're not familiar with this plan, go on the Chiro Congress website, look at the information that's there in the resources tab, because you will be amazed at what's happening to move the profession forward. And by the way, we are all volunteers. None of us are being paid to do this work. It's really a passion of love for our profession and the patients that we serve. So again, specifically as it relates to data and how it's driving results for the profession, and ultimately I'll share how it's going to drive results for you as individual providers, how it's going to drive your cash flow, how it's going to drive your revenue, how it's going to drive your profits. Let's focus in on Chirotech Consortium's goals. Well, I want to share with you really quickly just like why this is so important, why technology is so important. Now, when I'm in a room, and Brad has heard me talk about this all the time, and so is Christy, when I'm in a room, I'd be asking questions around, like, what do you guys do every single day? Like, do y'all stay at hotels? Like, who stayed at a Marriott? And then people raise their hand, everybody stayed at a Marriott. Great. How many people have ever heard of Airbnb? People raise their hands, they've stayed at Airbnbs. And the difference between Airbnb and the Marriott is, how many hotel rooms does Airbnb own? Well, they own 0. They don't have to make the capital investment to invest in properties to sell hotel night stays. So Airbnb doesn't own literally any hotel rooms, but they're one of the largest hoteliers in the world. And by the way, they've got a larger market cap than Marriott, which is the largest hospital chain company in the world. If anybody's ever been to DC and you've ever taken a cab in DC prior to some disruption, taking a cab in DC 10 years ago was brutal. It was the worst experience of your life. How many people have ever taken an Uber? And again, if we were polling people, or if I'm in a room, everybody's going to raise their hand. Like, everybody's taken Uber. How many cars does Uber own? They own 0 cars. So how does that fit with their profitability model? They don't have to invest in cars and car insurance and drivers and labor in order to drive exponential revenue growth. Anybody ever use Blockbuster? Some of the younger people on this podcast, on this webinar, probably have never even heard of Blockbuster, but used to go to Blockbuster and rent, movie tapes. But Blockbuster doesn't exist anymore because guess what? Netflix came along and said, you know what, this whole brick and mortar idea of renting space and hiring employees to give people movies that they can take home and then drop off 3 days later, probably not the best model anymore with the advent of technology. How many people use and leverage Netflix? I know I do. I love Netflix. So what does this all mean? At the end of the day, driven by technology, the cost of supply goes down. You're not buying in creating real estate investments. You're not buying cars. You're not buying videotapes in brick and mortar stores. So driven by technology, the cost of supply goes down. Therefore, more buyers enter the market and sales and profits grow exponentially. We call this exponential organizations, exponential verticals, and these exponential companies, these exponential industries, they are disruptors. And so when's the last time chiropractic disrupted? Like literally, maybe 1895 when DD gave his first adjustment and it changed healthcare forever. But like seriously, like when is the last time we have disrupted? Guess what? The time is now. And with the advent of big data, we once again will be able to disrupt. Now, all these concepts, I wish I was smart enough where they came from me, but they didn't. They came from the book Exponential Organizations, written by one of the foremost experts in technology, Salim Ismail. I heard Salim talk at an entrepreneurial conference. He was actually the first speaker and my favorite speaker of that event. And by the way, there were some high-level speakers at that event, but he just blew my mind. I ended up reading the book. It became one of my most favorite books I've ever read and literally changed my life forever. Now, in this book, he talks about the important components of what drives exponential organizations or industries. First and foremost, you have to have a massive transformative purpose. And like, I know us as chiropractors, like, of course, we've got a massive purpose to transform healthcare for not just people in the US, but for people around the world. And we have to be information enabled. Exponential organizations, exponential industries are information enabled. And so again, data plays a huge part in us being information enabled. So what about chiropractic? Do we have massive transformative purpose? I believe that we do. Are we information enabled? You're going to see today what Brad has created in order to help us become and continue to be information enabled. The exponential organization formula has multiple components to it, but today I really want to focus on dashboards and really like leveraged assets, leveraging the data that Brad has allowed us access to as a profession so that we can own our own data and therefore own our own future and literally drive change in healthcare at large. At the end of the day, when we were done with that meeting in Arizona, I showed you those pictures of us in our work group when we did the question storming components. We said that we needed to have dashboards, legislative dashboards, reimbursement dashboards, work group dashboards, like how we were going to help the other work groups in the plan show their results and the impact that we're creating for the population at large through research to help us understand how chiropractic improves outcomes over time. Like we need these dashboards. And essentially, again, through this work group that we created, we set very specific goals and timelines to create these dashboards. By the way, this is what we had over 90 ideas that were shared by the group. Brad, do you remember this day? We had 90 ideas shared by the group. I know you weren't there, but you were on the Zoom. What did that feel like for you? Like when we were sitting there going through all these ideas?
Jay, it was amazing for the fact that there were people that were contributing in a very group kind of situation that I'd never seen happen in this industry and profession before. So there's obviously a lot of excitement about trying to change how we're perceived in the environment, how that profession is perceived, and tons of ideas to do it.
Yep. And ultimately, when we went through these ideas, do you remember, Brad, we kind of drilled down into those most important elements, and it got us back to the original ideas of building dashboards. You remember that?
Yep, absolutely. And dashboards are quick ways to disseminate information in ways, Jay, that a lot of doctors and healthcare providers just don't have the time to drill down into the data and understand it. Dashboards are great ways to show it to them. They get it within a few seconds or within under a minute in most cases and can really identify with what's going on.
Yep. And we're going to show everybody exactly how to do that based on what you've built for our profession. So Infinity is Brad's company. It's a clearinghouse company, and he takes all of that information from the claims data that we submit as customers, and he basically makes it usable for us so that we can actually make better decisions in running our practice, make better decisions in fighting insurance abuse, make better decisions in driving improved legislative policies so we can get more than 14% of the population seeing a chiropractor. And again, I'm going to say this over and over again, guys, like Brad is the person who's making this happen, and he's not charging us for all of these dashboards that he's creating for the profession. So let's go through this. Now, full disclosure, Brad does not pay me for sales. Like, I don't get paid by Brad for every sale that we create if people decide they want to go to Infinity. But I will say this, I do believe in my heart of hearts that every single person in this profession needs to go to Infinity as the clearinghouse, because, well, you'll see in a minute, there's not a lot of other people. There's no other person, and there's no other actual company that's allowing us to be information enabled where we own our own data. It's only Brad. So let me share with you what he's doing as part of the strategic plan at the national and state level. Every single state association leader has access to the information that I'm about to share with you. And we just did a webinar through Chiro Congress. What was that, Brad? 3 weeks ago?
Yeah.
Sharing all this information. And now Brad has unlocked access to this information for all of the states. So this information around claims analysis, what is the billing performance? What does it look like at the national level? What does it look like at the national level last year, year over year performance? What about healthcare quality? How long does it take to submit a claim? By the way, all of this in blue is literally claims that are submitted within 7 days. All of this in these other colors, which represents about 33% of total claim submission nationally, that's going through Infinity. 33% of the claims are not being submitted within 7 days. That's mind-boggling to me. That's providers out there, some of you on this webinar, that are not submitting your claims within 7 days. If you want to improve your cash flow, you must submit your claims within 7 days. The procedure, here's billing performance. Again, like, what does it look like at the national level this year and last year? What's billed, what's allowed? Insight into how we are getting paid. Again, claim care to submission efficiency. Again, you can see some of these claims haven't been submitted in over 90 days. Like, I don't know how that is possible. So if you have access to this information for your own practice, and I'm going to show you exactly how you do, and you will, you look at your team and be like, insurance CAs, why is this information not being submitted? So access to information enabled at the professional level and at your clinic level makes a difference as it relates to cash flow. Patient volume, how are we doing for our new patients? How are we doing for total patients? And you can see here during certain holiday seasons or certain events that happen, patient volume drops. Brad has shared with me and shared with us at the chiropractic profession level, like, globally, we can see trends in volume across the board, and it's very consistent. The months that we're seeing the most amount of volume in chiropractic offices is between March and October, and November, December, and January, February, typically slower months. And that's by provider and also in aggregate. It's just very interesting to see that. If we know that going in, yes, we know that inherently for our practices, but if we know that that's the case globally, what can we do individually and collectively to raise more awareness during those months and drive more people than 14% of the patient population coming into our offices? The more data we have, the more information enabled we are, the better decisions we can make for our profession and for our individual practices. Error analysis. Oh my God, this is a huge one. Like, do you know the errors that you have in your practice for submitting your claims? Do you have a way to track that? Because if you don't know where your defects are occurring and you don't know why that's delaying your claims payment, how are you supposed to make it better? How are you supposed to make it right? Now, when it comes to delayed in claim submission and these errors that occur, Brad, you and I have had many conversations over coffee, over beers, sometimes very good wines. We've had conversations around what you've seen at the individual provider level. Like, what are some of the mistakes that you're seeing with these providers?
You know, it's pretty funny when you look at it, and sometimes it's regionally driven, and sometimes it's just an office not paying attention when they're submitting the claim. Simple thing, zip code. Sometimes putting in the incorrect zip code on a claim, it gets rejected because that's not where the provider's registered. we're developing schema now that in the near future, in the next year, we're going to put some wizards on there that are going to help practices when they submit claims, that we help identify some of the things right up front. We're doing a good job of scrubbing claims, and what you're seeing on some of these errors are pre-scrubbing processes. Once we scrub through them, we go from about an 8 or 9% rejection rate to about a 0.5% rejection rate. So just filing to infinity, we've got such a great scrub system for chiropractic. We're trying to eliminate all of the possibilities up front. But some of these things need to be fixed at the practice end, where they're just simply stop making mistakes, Jay.
And it's costing them money. I mean, that's the problem.
Yeah.
It's costing them money. And again, we're going to drill down to the provider level in just a second. I'm going to show you an example of my instance for my practices. But it's just so important that you guys understand that the ability to have a dashboard is critically important, certainly as a profession where we can use this information to fight payer abuse, which I'll show you in just a second, to go to self-insured plans and say, hey, Cisco, hey, Facebook, hey, Google, hey, IBM, like, look, you're spending X amount of money on your musculoskeletal spend. Look what we can do in terms of cost. Look at how we can save you money over time. But what I understand about running a practice, because I've been doing it for almost 30 years, is that we as doctors, as clinicians, as caregivers, and we as entrepreneurs don't want to get like bogged down in the minutia of denial codes. Like we just don't. Like maybe there's a couple of you out there that do, and good for you. Great, you can do that. But the idea that you have a dashboard that at a high level, you can look at a problem and see it immediately, and then tell your team, hey, what's the issue here? If you don't know, figure out why, understand the root cause, and then come up with a long-lasting solution to make sure it doesn't return and drive better results, reduce defects, and improve your cash flow. Dashboards gives you the ability to look at something very, very quickly every single day so you can identify where your staff needs to make improvements to drive improved cash flow.
Jay, I think it's important right here to inject the fact that one of the singular most important things that can be done is providers, clinicians need to accept electronic remittance advice. Getting those remittance, those payment information in a digital form is very, very valuable. You're only seeing a fraction of the clients that we have because we still have a large percentage that want to get those paper EOBs in their office. That's one of the things that I don't quite understand as a clinician is, why do you want to do that? Why not speed it up so that technology companies like Infinity, QVH, some of the app things that you're doing can model that payment information for you? So it's really important to accept electronic remittance advice, basically electronic EOBs.
Yep. And Brian, I'm so glad that you brought that up. And I'm anybody out there who's not using ERAs, not using electronic remittance advice, not using technology to post your payments to your system, I have 2 words for you. Stop that. Like, I'm scolding you right now. Yes, I'm freaking scolding you. Stop that. Humans make too many data entry errors. That's known. So don't, and also it takes too long. You're paying somebody to do data entry when technology can do it for you at a fraction of the freaking cost. So stop that. Use ERAs. You want to improve your cash flow? Stop having humans do things that technology should be doing. Okay. Sorry for the scold, but got to do it. Okay. Error claim rate, like understanding like where we are with the number of transmitted claims and the number of error claims that we have at a national level, really, really important. We can drill down to this at the national level and the state level. So if there are issues with certain states getting paid because, well, the insurance companies want to mess with you, we can see where this occurs and do something about it at the advocacy level. Again, national resubmission counts. We have to resubmit claims when there's errors. We can look at this at a very high level, the national level and the state level, year over year. We can slice and dice this data over time. Very, very, very important. And then claim error frequency, to me, this is a huge one. These are all the reasons why claims get denied. Do you know, like I'm speaking to you, the audience out there, do you know why right now? By the way, if you're doing paper EOBs, like I'm sorry, paper EOBs or electronic EOBs, excuse me. Like there's no way that you'd be able to know this information. You've got data in aggregate that's telling you exactly why you've got errors on your claims. You can't do that using paper. So again, like this is really important data when you can identify the defects in a process and you can understand the root causes of those defects and you can fix those defects with a control plan so it doesn't come back, you're going to improve your cash flow. But you've got to have access to the information, and that's where dashboards are so incredibly key. Lastly, payer analysis. Again, this is all part of this platform. Payment destination, is it going to, what's the total paid? How much was reduced? What is the total patient responsibility? And then maybe it's unknown. Maybe we're not exactly sure how that claim was paid. But the vast majority you can see here, if you've got a certain amount of money that's been paid in total and a certain amount that's been paid by the patient and a certain amount of write-offs, we want to know this information so that we can really predict cash flow based on what we're billing.
And Jay, you can drill that down by the individual payers within your state. So it's state specific or actually provider specific, what payers that they're filing to. So you can actually drill down payer by payer and see what payers are doing you good and what payers are doing you wrong.
Yep. I'll show that in just a second. I love this also. Brad created, this was a new addition to the platform. We could look at our total visit count. Like if our visits are down, is everybody down or is everybody up and we're down? Like what are we doing wrong? What are we doing right? What Brad created this, it's really like a heat map, and it's telling us who's going up, who's going down, which states are doing better, which states are doing worse. And you can drill down all the way down to the county level. So really great information. And to Brad's point earlier, being able to break some of the payer payments down by payer, how much are we getting paid? What's accepted? What's denied? Oh, United Healthcare denying half of what we bill. Go figure, people. Aetna delivering the next higher amount of denials. Go figure, people. Like we know this is us, but having insight and then learning how to fight those denials, really, really, really important. So let's talk about the denials and the inappropriate bundling. Through Brad's data, we've actually been able to identify the percentage of times that our E&M codes get bundled with manipulation codes. So when a level 1-2 manipulation is being built with a level 1-3 E&M code, we're getting bundled nationally 28% of the time. When we're building out a 98941, so 3 to 4 regions adjustments, and we're building it with a 99213 E&M code, we're getting bundled 33% of the time. Why are we getting bundled more? Because they're paying us more for the manipulation, so they definitely don't want to pay us for the E&M code. When we're billing out a 98942, even higher at 37%, at 37% plus for 99213 when we build out a 5-level adjustment code. So because we now have insight to this information, we can fight the payers. We had a meeting with Aetna, their national medical director, their chiropractic medical director, their VP of networks. We sat down with them with this data and we're like, we know you're bundling us, you SOBs. Like we have the data now. They're like, oh, okay, well, yeah, well, we're doing this because we don't think you're actually doing the work of the re-exam of the 99213. So we're asking you if you just send us the documentation and then we'll pay it. And we're like, well, first of all, isn't it we're innocent until proven guilty? But okay, you're instituting this policy. We'll send you the data. We'll send you the documentation. But if we demonstrate that we're documenting and doing the service to the patient, will you turn the edits off? And Brad, do you want to tell the story of what we did with Aetna and my practice based on the data that we had?
Well, Jay, I mean, this isn't statistical fluff. This is one-on-one. We looked at over 200 million claims to make this determination. And theoretically, we could go back and produce every claim that was submitted to submit to that.
And resubmit.
Yeah. Aetna came back and said, yeah, we'll shut it off. All you have to do is show us that it is occurring. And it was very easy for you to do. You did that in your own practice and was able to get it shut off.
That's the power of data. You guys want to improve your cash flow? You've got to leverage data. They turn my edits off. I no longer get bundled when I bill an adjustment code with an E&M code, period. End of story. So
37% increase in revenue. Never done that.
Exactly.
Jay. Just
exactly. Snap of a finger, right? Like, okay, it wasn't a snap of a finger to get the data. It took a little while to aggregate the data, but at the end of the day, we had it. And we're information enabled. When we're information enabled, we increase our cash flow, we grow exponentially. That's what it's about. Again, to Brad's point, listen, if you're not submitting if you're submitting through Infinity and you're not doing ERAs, just turn it on, please. Just call them and be like, can I turn this on? Because it will save you so much time and so much money and so much aggravation. Brad's platform, again, I don't get paid for these sales. Like, God willing, I hope you go because it's good for the profession and it's good for your practice. But like, I don't get paid, but it's $66 a month, people. You probably spend more on that at Starbucks every single month. So like, if you're using a quote unquote free platform, just recognize the fact that nothing is ever really free, because what you don't have access to is your own damn data, your own information. I know everybody wants free stuff. Like, I want free stuff, said every chiropractor ever. But guess what? Is Availity sharing their data with you? No, they're sharing it with the freaking carriers, but they're not sharing it with you. What about like Blue Cross Blue Shield and Humana? All the claims that are going through their systems, because we do a lot of work with the Florida Chiropractic Association. Are they sharing their data? Hell no. They know the data, they have your data, but they're not sharing it. Change Healthcare, another. How big is Change Healthcare, Brad? How many billions of dollars are they worth?
$16.9 billion.
And who owns them?
Now United Healthcare basically owns them. Optum or United Healthcare owns them. And there's a reason for that. Think about it. Why? Everybody thought, why would they want to spend and get into the exchange of claims? Guys, listen, claims data is going to drive all of healthcare throughout the future.
Yep.
And it's going to be done through value-based healthcare. And that's another subject matter we can talk about later at some point in time. But understanding it, with that one acquisition, United Healthcare now has probably 80 or 90% of all of the claims interaction of all their competitors, of all the payers in the United States. They are now the most information-enabled organization that exists. And are they there to represent you or to help you as a profession? I would say no. Jay sure says no.
Yep.
But you know that there is no other organization that I know of that is feeding back to the profession, to the industry at all, Jay. We don't see them at any of the conferences we're at anymore.
Nope. And so again, it may be quote unquote free. You may not want to spend $66 a month, but what are you losing out on? Does United Healthcare and Change or Availity, do they have dashboards for you that you can actually leverage and drill down into? And can that, and equally as important, can that information be rolled up at the state and national level to identify patterns in reimbursement abuses? Can that happen with these other companies? And the answer is no. And it pisses me off. So like, don't do it just because it's free. Sometimes you got to spend a little money to make a lot of money. And when we can do it in our own practices and we can grow chiropractic together and see more than 14% of the population, we all make a lot more money. $66 a month, people. Okay. Infinity Analytics. Now I want to get to the provider level. So give me 1 sec and I'm going to log in. And Brad, if you wouldn't mind, as I'm logging into my own instance, do me a favor, just share with the audience a little bit more about kind of the data scientists that are on your team that are doing these types of analyses to evaluate the data. Because you spent hundreds of thousands, maybe even millions of dollars employing these people. Maybe just share a little bit about the kind of work that they're doing.
Sure, Jay. We started out into this industry as a tiny little company, really working actually for the first IPA that existed in Oklahoma. And understanding that.
And by the way, really quick, sorry, Brad, IPA, he's not talking about beer companies. He's talking about independent physician associations that was started by a group of chiropractors in Oklahoma.
That's right. A group of chiropractors in Oklahoma, one of the first that I know, came together and said, hey, let's do this as a group. Let's fight the battle as a group instead of independent. And they were very successful, but it was very rudimentary analytics. And we carried that on and we helped that grow in some other states and very successful at doing that. And I took a stance about 3 years ago, and said, listen, there is so much to do and so many things to change the future. I started a startup analytical platform company that really builds software, builds platforms. We had one of the first accountable care organizations that was located in Southern California. We also did MIPS registries where we were understanding MIPS, understanding the valuation of how to assess when treatment was done and look at those outcomes kind of based. And that's led to a new platform that we're developing that that you'll be hearing about in the next year. If you're at one of the conferences where I'm speaking or Jay's speaking, or we're both speaking, you're going to hear and see some of the screenshots. We teach an ethics class using that kind of information that's really going to look at healthcare and patient information in a totally different way. For the first time that I know of, we're going to be able to connect all these EMRs, all the hospital records together so that a clinician can see what's going on, not only in their practice, but what the other clinicians in that patient's life are seeing too. That is truly the highest level, the greatest expanse of information enabled that you can get to. And for the first time, I think chiros are going to see information that other clinicians, the primary care, their orthopod, their cardiologists are doing, that they've never seen that before. And the other side of that coin, those providers, the primary care, the orthopods, the cardiologists are going to see what the chiropractors are doing for that patient for the very first time. Yep. And that's an exciting thing to do, but it starts off in these little steps. And I think you're getting ready to show your own personal dashboard. Yep. Every Infinity client has been given free access to this analytical information that we're going to be constantly changing. We've already made updates to it. We're going to be making more updates. We're going to be shortening the period of when that information is available. So I hope that's a good lead into what you're going to show here, Jay.
It's fantastic. Thank you. So yeah, this is an example of one of my providers' dashboards. And again, some of the things that we've talked about, like billing performance, healthcare quality performance, care to submission efficiency. So I want to drill into this. Oh, hold on. I think I stopped sharing my screen. 1 second. Let me get back into this.
I think you're sharing your screen. You're just not, you're still sharing the PowerPoint.
Okay.
There you go.
So if I would drill down to a care to submission efficiency and look at how our company is doing with submitting, how fast. This is my company, people. Remember what the national picture looked like? A third of people were not within 7 days. What is this? Let's see, 97% of my claims are being submitted within 7 days. And of course, our cash flow, we get paid quickly because we're submitting our claims quickly. So drilling down a little bit more, this is a really good one as well. I love this. We were receiving letters from a local payer saying, you know what, you're billing too many 98941s. And when I say we as the chiropractic profession, we were seeing that like, oh, you know, lots of people were getting letters like, y'all are billing too many 98941s. You know, the rest of the network is not billing many 98941s at all. And you remember this, Brad? We had this conversation. We drilled down into the data. It's just not true. They're lying to us because they want us to bill more 98940s. This is my data right here. Not my data because I don't see patients, but this is one of my providers' data. This is how many 98941s he bills, on a percentage of the time of total procedure codes billed. This is the state average, right? And by the way, that's not like, that state average is like 17 or 18% of total procedures billed. That's not a lot. But these payers will send you letters and literally they're liars, pigs, and thieves, and they'll say stuff to you that's just not true. If you want to fight them, you could just literally, you could say, that's a lie. It's not true. I have my own data. I have state data, and you're a liar. Whatever insurance, plug in any insurance company that you want to. Brad, did you want to comment on this at all?
Well, I want people to understand in context, this is one provider within all of your offices, not your entire office. So you literally can drill down on each individual provider. If you're a solo practitioner, you can understand what you're doing. If you got a lot of doctors in your clinics, you can look at every one of the individual on top of the roll-up of that.
Yep, that's perfect. So just an example of how you can be empowered through this information. Diagnosis code frequency. I mean, I thought this was kind of interesting. I'm a data geek, so I think everything is interesting when it comes to data. Just, looking at the frequency of certain codes that are being billed compared to like what we're seeing versus what the rest of the state is seeing. Patient volume, both in terms of new patients and existing patients. I'm going to have to go a little bit faster now because I'm running a bit out of time. But again, error rates, like what are our error rates? Like, I mean, this is kind of crazy, but like we don't have errored claims. Like if you look at how we've done in terms of our transmitted claims, we're at 100%. We're essentially perfect. Now, I could do a whole nother webinar on how we created an execution strategy on not having errored claims. Happy to come back and we can talk about that again. But like, if there were errors, at least I would know, and I would go to my team and be like, where are the defects occurring here? How do we fix this and have a control plan to make sure that it doesn't come back? Any resubmissions that we have to happen based on whatever reason, insurance company nonsense. This is the national level, right? This is green. This is us down here. So we don't have any resubmission, and that's why our claims are getting paid. Again, error claim performance national level, where we are as a company.
That's
And
really
again, like, I
important.
don't say this to you to brag, but it's important for us to know, because if we were above the national average as it relates to errors, like, I'd want to know that so I could talk to my team and we could fix the defects. Brad talked about drilling down to the payers, the payer analysis, what's happening in terms of how, who's getting the money, what are the adjustments? Because, if we're having to adjust our payments, what are those reasons why? Contractual obligation, okay, that's a big one. What about over here? Why are we not getting paid? Contractual obligation, payment adjusted because the payer deems the information submitted does not support the frequency of whatever procedure that we're supplying. So we've got to go back, and we have the opportunity to go back and be like, hey, payer, here's the documentation. So pay us our claims. Now, it's not happening a lot, but it is happening. And so we want to make sure that we get those claims paid. We have insight as to the reasons why. Payment efficiency, how long does it take for us to get paid? Pretty quickly, within 15 to 30 days is the vast majority of our claims with this particular provider. I don't know how it is for you guys, but like, I like getting paid within 2 weeks. It's a pretty good thing. Procedure code allowed amounts, diagnosis code allowed amounts, all interesting pieces of data that we can leverage in order to understand if our procedure codes for certain procedures, what does that look like in terms of how are determining treatment plans, how we can predict cash flow based on the treatments that we're delivering for our patients. So again, this is insight into what we do and how much we're getting paid based on what the providers, the insurance providers are allowing us in that particular code. Lastly, again, the financial analysis. Again, there's a lot of data to load here, so let's just be patient. But when it comes to looking at the financial analysis of our payers, and I know we've got a lot of them, we can drill down by payer and see exactly what's collected from the payers, what's collected from the patients, and any any cash reversals. Like if the payer decided they wanted to take money back, why did they take it back? How much was taken back, etc. So again, we have insight into our payments. Who's our biggest payer? We can see here. Who's our smallest payer? We can look at these factors, and then does that determine based on what the allowed amounts are? Think about this, guys. If we know our largest payers and we know what the allowed amounts are, and we know the procedures that we're providing for our patients, couldn't we then target employers with our marketing strategies to get the best insurance companies to pay us? Yes, I think that we could target our marketing. In fact, we are very specific with our target markets of who we want in our practice and who we don't. The number of weekly transactions that are occurring over time. Again, what's accepted and what's rejected. Interestingly enough, I showed you national data. It is exactly the same in my practice. United Healthcare is rejecting about half of what we bill. Aetna is rejecting, not a lot, not as much as they used to, but they're probably rejecting, 15% of what we bill. Now, some of that could be like, they only allow, 4 procedures for a given patient in a given visit. We might bill 5 in a given visit. So those might be some of the reasons why those are rejected, but at least we know what that looks like in terms of accepted versus denied, what it looks like historically over time, how much the payer is, how much we're getting in gross collection, how much we're getting in net collection, and what are our weekly correct collection rates over time. What does it look like for gross? What does it look like for net? And how can we drive better revenue over time? So Brad, again, you've got given us great insight into kind of our payer mix. How does this help providers make better decisions about their practice over time, in addition to the marketing things that I've talked about in the past?
Well, Jay, I find that most doctors come to me and say, Brad, I don't have time to look at anything new. And so we made this phone enabled. So guys, 1 minute once a week, you'll probably understand more about your practice looking at this dashboard than you will if you'll go next door and talk to your office manager. And too many of you depend on that office manager to run your business. You're ultimately the person that's going to be responsible in an audit, in any kind of financial transaction. They're coming after you. It's important. That's part of the reason for being data enabled, is to understand where you sit in the world, how you can do it. We didn't even go into the audit protection things that can occur from this. But Jay, there are guys out there in the world that are using our system for audit prevention and fraud detection when they get audits brought on to them. It just changes your world. And if you can't see that, what are you doing? It is so clear to me, but you and I have been preaching this for a long time.
Yeah. I mean, we live in this world and we understand it. And I understand, like, for some of the audience, this may be very, very new, but the important thing to understand is you don't have to believe us to know what's going on in the universe today. I mean, just look at all of the other companies that have grown exponentially. Google, Uber, Facebook. I'm not saying good or bad about these companies, but one thing that there is no denying, they have grown exponentially. If we want the profession and your practices to grow exponentially, which is why we're here today, you must be information enabled. And Brad's platform is a critical element in helping us do that. Again, I just want to get back to that audit point really quickly. Imagine you're sitting in a courtroom and this company says, you're building too many of these codes, and your other peers do that, and you and your attorney put your dashboard, like, that's not true. Just not true. It's a flat out lie. Like, what does that do to their case against you? So again, we know that insurance companies, they have line item budgets every year on their budgets. Insurance companies, they have it. We've talked to auditors. They have a certain amount of money they are responsible for getting back from you. Like, that's their job. They got to get money back from you. And the more data that you have to demonstrate that you're a normal provider, you've got good practices, you've got good document practices, they're going to leave you the F alone. But if you don't, not information enabled, they're going to come at you, and they're going to come at you hard. And we've seen it happen over and over and over and over again. So in summary, guys, the chiropractic profession is moving forward. We are becoming much more information enabled. State and national leaders have access to dashboards that's going to drive policy, that's going to drive equity and reimbursement. It's critically important that you jump on the information enabled train and join us, because we want you to be more powerful. We want to empower you to have the practice of your dreams and support the profession so that we can help more than 14% of the damn population. So those are my final words. I'll let Brad, because I could talk about this all day, I'll let Brad share his final thoughts as well. Brad?
Do you understand why I call him the data doc talk? Because he really is. He gets this better than anybody I've been around, and that's part of the reason why Jay and I have hitched our wagons together about educating. You know, Tech Talk is a fun thing, and as Christy mentioned, she gets a kick, and I know she's listening to it every week. But we talk about the subject matter. We have great experts all the way from national levels down to the individual provider, practice manager, some of the software vendors out there. It's a great way to spend 30 minutes every week listening to this, getting refreshed, and getting energized about it. I don't want this to be a sales pitch. I am doing this trying to help advance the profession in what they're doing. It's the only way that I've been able to get together to collect and funnel that information. We are passing along huge amounts of information at a national level, at the state level, and we're trying to educate you in your office with you as an individual clinician. So thank you, Jay, for being our spokesperson. Thank you, Christy, for hosting us today. And everybody knows how to get hold of either one of us. Please feel free to do that.
Thank you both so much. I'm going to end with one quick question. You were talking about it's only $66 a month, but it has a much bigger financial impact on your practice. So I'm curious, Jay, when they finally did turn those edits off, how noticeable was that financial impact?
Oh my God. I mean, we're talking about tens of thousands of dollars, Christy, and it's twofold, because it was more revenue for our practice that we realized right away when they turned the edits off. And again, we have multiple locations. So, you know, I just want to provide context. It wasn't just like one practice where it was tens of thousands of dollars right away, but with all of our practices, it was. but it was the work and the frustration of my team that had to deal with. And we have a billing company. We use Genesis chiropractic software, love them. And they do our billing, but there's still things that we have to deal with when the claims are denied, like providing medical necessity and, uploading them, telling them they know, but like uploading the documents. It was still time out of our day. It was frustrating to deal with it. All that's gone. Like all of it is gone. So we remove the inefficiencies that cost us money. So we increase revenue and reduce inefficiency and cost, we make more profit. It's just a simple mathematical equation. So it's been a game changer for us.
Well, and I think the really important thing to think about is that the frustrations that you have are the frustrations that doctors all across America are dealing with. And some of them have the manpower to upload documents and try to battle this. But more often than not, what we do is we go to state association events, we complain to the association, we complain to each other. We talk and say, that's it, I'm done with third-party payers. We're just going to go all cash, which financially just isn't feasible. It's just not a good idea to put all your eggs in one basket, but that's just one girl's opinion. What's interesting is that here we have some software. You actually have the data so that when they lie to you and say, that's not what we're doing, you can actually say, well, yes, it is. And it's interesting is that I've heard you tell this story. I've heard state association executive directors who I always tell them, you need to call Jay and Brad. And then they go into these meetings and they're told time and time again, we're not doing that. But now they have the data and say, well, yes, we do. And it makes it easier on a state level for your association to help you fight those battles and for them to attend those meetings when they have access to the data. The only way they have access to that data is if you're using Infinity.
That's exactly right, Christy. You just summed that up beautifully. That's what has to happen. We have to be on a common technology platform for Brad to be able to give us the data, for us to be able to own all this information. Hey, Christy, you broke up a little there. Say that one more time.
I said, I think the time has come where third-party payers have more information about our practices and they're using that information against us. And it's time for us to know our numbers and use it to fight back to get what you rightfully deserve.
Amen, sister.
Absolutely.
Amen.
Absolutely.
All right, gentlemen. Well, that's going to be a wrap. So I never fear. I know that many of you are super bummed that you did not get to do this live and in person. Have the opportunity to ask Jay and Brad all these great questions, but not to worry. If you have questions after watching this recording, if you will email them to me, Christy@chirohealthusa.com, I will get them to Jay and Brad as we will all be together multiple times in the next couple of months. We'll get your questions answered. We've already started looking at our calendars because I'm sure there's more information to come. And we're going to have them back here again so that we can have them live and in person in the next couple of months where we can have an update on this information, where we're going and what we need to, again, move the profession forward. And it's not one person's job. It's not a group of 400 or 4,000 people's job. It's the responsibility of everyone in the profession.
Well said, Christy. Well said.
Thanks, Christy.
Bye, everyone. Have an excellent week.
Bye, everybody.